Thank you. Would you please introduce yourself for the record?
Yes, my name is Molly Dugan, and I'm here today to express my enthusiastic support for safe injection sites in Boston. As a social worker who specializes in addiction, I often work to educate my patients around overdose prevention. We talk about how to keep your equipment safe, how to do test shots, how to get access to Narcan, but one of the most important pieces we talk about is not using alone. People who struggle with addiction are used to hiding what they do for a lot of reasons, but a driving force is the shame that is reinforced by the society at large. My patients inject alone in locked bathrooms because they don't want to disappoint their families, friends, and coworkers. They use in secret because they have learned that asking for help brings about negative consequences. They lie about using because we criminalize their behavior when they're honest. Our systems make people want to use alone, and that stigma exacerbates the opioid crisis. What I've learned in doing this work is that people are going to do drugs. Some people want help with that, and some people aren't there yet. But a consequence is not great enough to deter someone if they are not ready to stop, and we know this because we know the overdose numbers from the past few years. So what if instead of punishing these people, we support them? We acknowledge that one way or another, people are going to use heroin and it doesn't make them unworthy of care, and we let them do it in a safe space. We let them come out of the alleyways and the public bathrooms and the rundown buildings they've been hiding in, and we connect with them, and we let them know that we care enough not to let them die. It might be radical and it might be something we haven't tried before, but if what we were doing were working, if drug courts and everything else that was referenced here today were working, we wouldn't be referring to it as an epidemic. I'm proud of what I do and I love the people I work with, and I'm willing to support anything that will make it easier for them to heal. There's no research that says by helping someone be safe, we make the problem worse. We have learned a lot from hearing about other safe injection sites already today. And I want to say that through this kind of support, we can increase the odds that someone will feel comfortable asking for help. Is this a perfect option? No. And will it be unconventional? Yes. But as a mental health provider who spends every day fearing that I will hear another person I care about has died, I'm tired of being told I need to stick to what's conventional. If you as an individual are uncomfortable with this idea, I encourage you to explore where that comes from and to ask yourself why your discomfort should outweigh the potential health benefits to thousands of our most vulnerable people. People have referenced the Long Island shelter today, or the Long Island services that were previously in place, as a popular idea because we liked the idea that we could put addicts on an island and not have to look at them. People like referencing the Shattuck because we can put them in a dilapidated state hospital where I worked for 4 years and not have to look at them. We need to be bold and we need to be kind to our friends struggling with addiction. Otherwise, we risk keeping them behind locked doors. I just wanted to say that I was disheartened to watch the conversation shift from a conversation about safe injection sites to a critique of already medically approved treatment, like Suboxone or methadone, or things that are effective to treat our patients. And it was hard to be encouraged that this body would be forward-thinking when we're not approving of what's already out there. Thank you.